Good afternoon. Hope you enjoyed your lunch, and now you're ready to hear all about a series of factors, at least some of the factors that contribute to presence, absence of trust. I'm Cynthia Beall. I'm from Case Western Reserve University, and I'm the moderator for this afternoon. Our first speaker is Phyllis Petit Nassi. She's the manager of special populations at the Huntsman Cancer Institute at the University of Utah. And she is going to speak this afternoon from a seat because she broke her ankle.
Good morning. I guess it's afternoon now, isn't it? I actually don't often need a microphone because the webcast. Yes, for the webcast. So I am an enrolled member of the Oto Missouri tribe and a member of the Cherokee Nation. I was born in Oklahoma, and I was raised on the Navajo, Hopi, and Zuni reservations. My first life was a geologist. My second life is now social work in cancer. I needed a new vocabulary. And I have had the great opportunity to design a program where myself and my assistant, we travel throughout the country. We are boots on the ground. We are in the community. And trust in science is a very big topic among our people. Okay, let me get this going. So, I think first, when you think about an American Indian, Alaska Native, how many of these people in this room really know what that is and who that is? I can tell you that even from my perspective as a Native American, I was actually born Indian. I went to study in Africa. When I came back to this country, all of a sudden I was Native American, and now I'm American Indian, Alaska Native. So if you ever have a question about what to say, it's so easy to ask. So who is an Indian? The first slide that I showed you was actually, wow, I can't go back. How do I go back? There we go. So we establish as tribes and follow in some tribes what was once the blood quantum system established by the federal government. And it was established really so that we would breed ourselves out. That didn't happen. But in order to be eligible to participate in a lot of programs, you have to have a quarter blood. It doesn't make any difference what tribe it's from. And some tribes follow this. And then you have the tribes that that are descendancy based, such as the Cherokee. My father's tribe, the Oto Missouri, we follow the blood quantum system. And we adjust the quantum as necessary, as other tribes do for getting money from casinos or subsoil lease rights. They increase the quantum so there's fewer people. We're just as corrupt as anybody else. There's also the fact that you can become a member of a tribe if the tribe decides so, as they did with President Obama. And you become a full member with all rights. There are 566 federally recognized tribes. We have over 100 state tribes and 245 that are still waiting for recognition. We speak over 217 different languages with different dialects. We are a traditional culture. We have very strong beliefs in our medicinal, our spiritual, and our healing that come from our leaders. The things that you see on this slide, myself and many of the people that I work with and many of the people that I do research with, we still participate and we walk in both worlds using these things. We respect our traditional practices and they contribute to our survival. The sweat lodge, the sand painting, cancer patients, a lot of my cancer patients go to the medicine man and ask for sand paintings to help them cure their cancer. We tie prayer feathers as part of our funeral rituals. We smudge, that's the slide right above me in the middle, for anything that will promote our healing, our well-being, coming back into harmony with our world. We respect our veterans. The American Indian Alaska Native is overrepresented as a population in the armed forces. And a lot of people know about the code talkers of recently, but very few people know what they did during World War II during Vietnam, going into the tunnels to clear them out. We respect and have an understanding for our environment and our land. The slide on my left is at Chuckle Canyon up on Fajada Butte. When I was a child, a small child, my father, who was working on Glen Canyon Dam, would put me there and leave me so I could go play in Chaco Canyon while he went and did his thing, whatever he did. And I used to climb Fajada Butte. The great part was when, during the summer and winter solstice, when it actually took place. So I show you this slide because our culture is very familiar with science. It has a long history and participation in it. The calendars, the seasons. So science is not new to us. The way it is practiced today is very different from ours. We have a belief, a common belief within the tribes of an unseen power. We believe that everything has a spirit and is moving, and so when you go into quantum physics and you're down and you're seeing those particles moving, it's because they're alive, and we've always known that. And our spirituality is directly connected to our health. Our end of life and palliative care is very important because most of us, almost 85% of us, die at home. We do not go anywhere. We go home. So our culture, as it compares to the non-native culture, is different. In particular, we prize modesty. You can see that in our tribal regalia when we're out, and we're exhibiting ourselves. You can see it in our spirituality. It is something that we have internally. It is not an external conformity to a person or an idea. This is something we live with day to day, moment to moment. Some demographics. There are 334 federally recognized and state reservations. What's most important on this slide is the last one. Over 78% of American Indians and Alaska Natives do not live on the reservation. We are surrounded by you, where you live. And what is very interesting about that is while I was sitting in the back and we were talking about trust just before lunch in groups, I said, so where are the people of color in this room? Why aren't they sitting in this room with us when most of us are not on the reservations? The largest tribes are the Cherokee and the Navajo. And when you take a look at where those largest tribes are, California hosts most Indians. And then you're going through Oklahoma, Arizona, Texas, New York. Can you believe that? Number 5. New Mexico, Washington, North Carolina, Florida, Michigan. I show this map because it takes a look at the United States at night. So you can see where rural and frontier is, and you can see now where those populations are of the 10 largest groupings reside. The reason for this is the center, where the darkness is, there still is a large group of people that are American Indian, Alaska Native, who do not reside in those areas. We grew by 27% from 2000 to 2010 versus 9.7% of the non-native population. We're growing very fast. We tend to be a very young population. 28% of us, almost a third, live in poverty. Now remember that 78% of us are not on the reservation. So a large portion of those people are living in urban and suburban metropolitan areas in poverty. And our median income is almost half to that of the rest of the general population. 77% of us achieve a high school diploma. 13% of us have a bachelor's degree. That's compared to 86% and 28% of the non-native population. A third of us, of all who non-elderly, live in these 5 states. So a third of our population is comprised in these states. We live in families with no connection to the workforce, so no one is working at home. And those who do work in low-wage jobs and do not have health insurance. We have high rates of chronic diseases. We experience some of the worst health outcomes of preventable diseases. And we have some of the highest rates of diabetes and obesity. More than a quarter of us are smokers, and we have the highest number of people smoking of any racial or ethnic group. A third of us, 20% of us are binge drinkers, and we are 4 times the US population for the risk of liver cancer because of it. We are the only racial and ethnic population that has chronic liver disease as one of the 10 leading causes of death. What doesn't get reported is often our mental health. 23% report rates of feeling anxious and depressed. And recently, on the Pine Ridge in South Dakota and North Dakota, the suicide rate for American Indian and Alaska Native youth is out of control. Our youngest suicide was 8 years old. 40% of us suffer from inactivity. Unintentional injury caused by car accidents is 47%, and of those 47%, almost 56% are due to drug and alcohol. And this is where most of the money that the Indian Health Service is spent. So, diseases, chronic diseases, they come in second. 10 leading causes of death. As of the publication, this published, cancer is finally the leading cause of death of American Indians and Alaska Natives. Other populations are following. This slide shows you we're 500 times more to have alcoholism than other populations. Suicides, 82%. No health. American Indian, no health insurance. 29% of us, a third. All races, 15%. Infant deaths. We suffer 8 in 1,000 live births to 6.8 in 1,000 live births. Our history is different. We have and suffer from historical trauma and unresolved grief. And why? And now, as we have our own land and land in trust, we become also those who take away our own land from our own people. The Indian boarding school system. My father went to Carlisle Indian school, and I went to a mission school on the reservation. The Indian boarding school system was part of Andrew Jackson's Manifest Destiny, and their mission was to educate us and to assimilate us into our non-native culture. But what was that experience like? First they took our land, and then I took our children. There used to be buses who came to the Navajo reservation in the end of July, beginning of August, and they literally went out into the desert, went to hogans, got kids, brought them back, had their parents make X's on the box on some piece of paper. At that time, my mother was a teacher, and I would come home, and all of a sudden there'd be all these kids at my house. And I had this long sleepover party. She was a teacher, and it was the workers at the school bringing their kids to our house so they wouldn't be taken away. This is where my father went to school. So the forced separation from their homes, their families, their communities, their friends, their socialization, and the experience of physical, sexual, and emotional abuse, and then the exposure of health to infections resulting in illness and death was a lot of the experience in these boarding schools, particularly in the 1800s when it started. It often happened that children would die. They would notify the parent who couldn't read, who had no idea what was on the paper that they were sent. In the past, I believe this was 2.5 years ago, when they were excavating one of the old mission schools in Canada, they found the handcuffs, little tiny handcuffs, that were for the children. So, we're talking about what the elements of trust are, how trust is built, maintained, and lost. So when you talk about trust, you have to know the way the group thinks, how they interact, how they communicate, how they educate. You have to know what their roles and relationships are. What are their values, their practices? What are the expected behaviors? Even to this day, when I go into a new tribe, or I go into a new population, I found the greatest part was going in trying to bring cancer education to ranchers. You know, I didn't think really much about it. I knew they were their own group, but trying to break into that was very exciting because my arm has been up the birth canal of a cow. They invited me for calving season. I had no idea what I was getting into, but I was able then to start learning how to be with them. And so what I've told you is really how trust is lost. How is it built back? I showed you this slide at the very beginning. It was a couple of my research fellows and my media coordinator at the Huntsman Cancer Institute. They were invited up to the Wind River Indian Reservation to take part in a sweat lodge. They were a little not quite sure what they were getting into either. But when you're asked, come, take the time, because they came and they started and opened the door for research with the Huntsman Cancer Institute. And how is it maintained? You go the distance. You walk with us. You come to us. You ask us. I became a PCORI reviewer. It is fantastic to have a voice among science. I don't do this alone. I want my assistant, my little sister, Lynn Hall, to stand up, please. We never do anything alone. It takes one person, one family, one tribe to start. And I always, always give thanks to the women who have led me. Betty Green, Selma Morris, who's no longer with us, and Dr. Linda Burhan-Stepanoff. Linda is Cherokee. Questions? No?
Questions for Phyllis?
Ida Chow, Society for Developmental Biology.
Yes.
So you told us how the trust was lost. And I think that probably applies to other groups as well. So in general, what would you suggest for us to try to rebuild the trust if it's really lost?
So one of the things that I do is I come on board research groups. And that's exactly what we start to do, is to build the bridge back, because for every researcher that gets it wrong, everyone who follows has a very hard time. And it starts with ramping up. And I ask for a year before we start anything. And one is getting that research staff out to wherever, or into wherever you are going, and becoming part of the community. The other thing is education. We want to participate. We want to be there, but we're afraid because of what has happened to biological samples that has been taken from us. And it's not the science, it's the scientist. It's the ethics of the person who is doing the science. And so spending time with us and being with us, because earlier we talked about the system that we have put in place of reward and siloing information because we don't want to share it because we want all those accolades that come with it. That needs to change. That should not be the reward, but our system is set up that way. But so, yeah, you teach them the IRB. You teach them what the research is about. They will willingly come. Yes.
Hey, Christine Scheller from the AAAS Dialogue on Science, Ethics, and Religion program. I wonder if you could speak more to the communicating science across the belief system, different epistemologies.
I'm sorry, I could barely hear you.
I wonder if you could speak more to the communicating science across the belief system, spiritual. You talked about spirituality and health. Can you just expand a little bit on that?
So as we move towards targeted medicine, and this is one of the things that I do, we have taken, and I'm involved in cancer, we have taken science away from cancer sites. It's no longer lung cancer. It's no longer breast cancer. And because science has moved beyond that, it has moved into a realm that makes more really sense to us, because it is within our cells and within our being that we really live. And we understand that more than we do somebody wanting a piece of our liver. It has changed. It has moved into a realm whereby it is, for us, it's more mystical. And a mystical world is something that we relate to. If that answers your question. Okay.
So how would, I'm Cynthia Beall, I'm the moderator, but I'm asking a question. How would researchers then explain, make the bridge from genetics to the spirituality and so forth? What explicit words or logic?
So one of the things that we have done is we do genetic testing, right? And so in order to do that, I put together a group of genetic counselors. My PI, which was Dr. Randy Burt, we were studying hereditary non-polyposis colorectal cancer. We had identified an index case. I educated them on what it meant and where we were going and how we were going and what was going on. I invited them to the sweat lodge. They took part. Then we went to the spiritual leaders. And we placed the research and what we were going to do at their feet. Ask them what they didn't understand. What did they need to know? What did they need and want? And what did this family need and want? Because this A, B, C, D, E was what we were going to do. And so it was that ramp up time. Exact words, it's going to differ from tribe to tribe. The most important part of this testing was when they said yes, and we could draw their blood, and we took them down to Myriad Laboratories. We showed them where it was going. They took part in every step of that process, and then they wanted their blood back. And they got it back. And so while we made sure we were there, we were able to help the family. There is a positive side to this. They saw this. We kept our word. We did what they asked. They did what we asked. And then we asked them to go public. And they went public. ABC, CBS came out and they did public service announcements on what it meant to have to be part of genetic testing. and how it impacted the family and the next generation. And I stress that they talk about both sides because, you know, sometimes there are family members who don't want to know the results. And there are sometimes when you find out those results and things happen, the people you're with don't want to be with you because they're afraid they're going to pass that on. So it's really making them part of that entire process. Genetics is not something we fear. It is something we understand when we're given the chance, when the language is brought down to a level where, and this is true for all groups, but the Native American, American Indian, Alaska Native are my family. It's different and it's harder because of our past. It was just yesterday. My mother was not born a citizen of this country. My father was not born a citizen of this country. It wasn't a long time ago. For us, it just happened. And so when anything has to do with the federal government, and that's where most money comes from, and when you have to disclose where it is, there's that caution, there's that fear, and you can see why. But it is possible because we do want to be there. I'm here.
Hi, Marcia Keene, Feinstein Keene Healthcare. You mentioned that you were part of PCORI.
Yes.
I guess as a patient representative,
Yes.
Right. I'm wondering if you think that PCORI and PCORNet can actually be helpful in creating a new model that could be replicated so that each one of you doesn't have to kind of do it on your own.
I think the model that PCORI has set forward, having stakeholders, I was also a stakeholder reviewer, gives and sets the stage for a brand new model of science in and of itself. Because we learn where it comes from. All of us need to know, you know, as the PI or as the scientist on the research project. And everybody sort of knows their part. I think being a PhD student where you have to know it all and go through it all, I mean, I became a phlebotomist simply because every single step of the way I wanted to have someone who had native, their toes in native water. And so we didn't have a native phlebotomist, and Lynn and I became phlebotomists on this research project so they knew. PCORI allows for this, asks for it, demands that people like myself, that people like the people who are participating in research projects be present. Not many research projects do that. And so yes, it's a new model. It's a model that needs to be everywhere. And while they start out with community-based participatory research, and now everybody's calling me and asking me to be a patient advocate on their research grants, it's like, whoa, wait a second. This is due in 2 weeks. You really think that I'm going to become your advocate on your research grant in 2 weeks because you wanted... They're trying to change. They just need to get us on the table before when they're starting to write the grant instead of waiting for 2 weeks and go, oh, we don't have an advocate. So yes, it's a great honor to participate in PCORI.
Thank you very much.
You're welcome.